Good morning, Jennifer Shepard with the Shepherd Center for Integrative Health. I should probably talk to you about sitting in your car, because I'm in my car all the time, and actually my posture is okay. Could be a little better, but my back's not very irritated, so it's not as critical for me as it used to be when my back was pretty grouchy. So, golly, 20 years ago, maybe 15 years ago, my back was really, really bad. I had just a lot of disc damage, and it would get hot. So it'd get hot, it'd get grouchy, it'd get swelly, it'd get irritated, I'd get some radicular pain down my leg, and it just was very, very vulnerable, and it didn't take much to irritate it. So at the time, I was doing fellowship in Steamboat, and also lived in Denver, so I was back and forth, so it was like almost a 3-hour drive. You could probably get it done in like 2:45, depending on snow and passes. But that time was really, really important for me to nail in, because my back just would start to hurt. And the unfortunate thing, so cars are made for the average human who sits in a slumped posture. I mean, most people sit kind of slumped, rounded in their pelvis, rounded in their back, forward head, right? Like that's traditional posture. And it's interesting, I feel like when you get in older people's cars, like so my mom had a Chevy Impala, and man, that headrest was so far forward. But again, older people, if they don't take care of themselves, they tend to go into that forward flex posture. And again, if you're in a car accident, you don't want a lot of space between your head and the headrest, so they bring the headrest closer to you. And if I'm incorrect in saying that, car manufacturers, please tell me I'm wrong, but this is what I notice as a orthopedic physical therapist and with issues of my own. So most cars, though, where the seat meets the back, tends to put our pelvis in a rounded flex position. And I have a handful of patients right now where, again, they've got some hot discs. They've been doing lots of bending, lifting. There's old trauma and inefficient mechanics, so their discs are a little hot. And prolonged sitting is where they get into trouble, or driving in the car, and add on some irritation to the nerve root. And then you got that also that foot, right? So you're irritating that nerve from the fence. So important for them to get as neutral as they can. And you'll see everywhere they sell lumbar rolls, and it's not about lumbar roll. That's not where yes, we need a little bit of extension at the lumbar spine, but that's not how we get it, because there's still flexion at the pelvis. So where we need to get it is, I tell most of my patients, you take like a sweatshirt, you take actually like a bath towel, fold it, you stick it in the crack of the seat, and you almost try to get it just underneath your sit bones. So again, your pelvis isn't rounded back, but you're a little bit more upright, and you're sitting on your sit bones a little bit more. And there, right there, you just saw I just shifted myself into a more neutral position. And I can probably stay there, but now what happens is I'm a little bit more upright. The back of my seat, it's not quite, I actually need to bring the back of my seat up a little bit. But then, actually what that does is it pushes my upper back forward a little too much. So Princess and the Pea, right? Tough finding that position. What would help me more would be to put that little towel roll right in that crack of my seat to bring my pelvis forward just a little bit. I think then I'll feel a bit more supported, and won't need to bring my seat as far forward. But when I was driving a Steamboat and my back was hot, I would be forward on my pelvis, and then I had a long pillow behind my back to help bring the seat up to my back just for more comfort. So things to think about when you're in your car, and if you've got some back pain, or anyway, just how to be more efficient. I've got some people where they're not my patients, they're friends of mine, but where they sit way reclined back, and again, that's really not great for their bodies. Fortunately, they don't have pain, they haven't had the injuries that many of us have had, where we can't tolerate that position. But the more efficient you are in actually another place where this is important is people who've overcome their back pain, but it still comes back here and there. When I go in to treat them, the pelvis is just kind of sticky and tight again. And what that tells me, what I can tell, and I tell them, I say, gosh, you've been sitting back on your pelvis. They've been sitting in that flexion, because when they sit prolonged in that flexed, rounded pelvis slump position, the innominate, which are part of the pelvis, tend to get stuck in this posterior rotation, flex position. And then when they go to walk, they have lost that extension because they're stuck in relative flexion, right? They lose the ability for extension, but they still get it at shear forces of the lumbar spine. So important in your car, so important when you're working to spend most of your time, not all the time, you need to move around and switch positions and stand, and sometimes you're kind of going to come into slump position, and that's okay too. Just make sure you spend more of your time in a more